All right, good, I guess evening, it's not even afternoon, everyone. And thanks everybody for sticking it out for like the last session before the gala. So appreciate all of your attention and all of your support being here. These are my disclosures. My two financial disclosures are not relevant to this talk. I should disclose I don't perform POEM, but when I was at Northwestern as a resident, we were just starting it in cadaver studies and things like that, and got to see some of those early cases that took forever to do. Again, thanks to Dr. Ziegler and Dr. Moreau and Sages for allowing me to argue on behalf of Heller in terms of post-myotomy reflux. When I got this topic, I was like, what is there for me to say? I think I've already won. So, but I'll try to add something to it. We'll have a little bit of fun with it. Fortunately, I've had Dr. Shada and Dr. Teitelbaum already go through the operations, procedures, a lot of the literature. I'll touch on the literature a little bit, but maybe I'll add a little something and have a little fun here in terms of other things to convince you, if you're not already convinced, that Heller's a better operation for achalasia from a reflux perspective. So is Heller better? With all respect to Dr. Spear, who couldn't make it, I mean, I think by default, if she couldn't make it, Emily, wherever you are, I think I've won. But the answer is yes. And I think we need to talk about post-myotomy reflux with regards to Heller, specifically for those who've also had a fundoplication that goes with it. Because if you do not add the fundoplication, there is definitely a higher incidence of post-myotomy reflux. This is a paper from Guillermo Campos and his colleagues back from Annals of Surgery, looking at GERD symptoms as well as abnormal pH testing after a Heller myotomy. And clearly in patients who did not have a partial fundoplication with that, the rates of GERD and abnormal pH testing were about 3 times higher. And I myself, again, I'm a Heller person. I do toupee fundoplications preferentially with my myotomies. So then the next question is Heller with partial fundoplication better? Which I think is probably the better question to ask. And the answer is still yes. So why is that the case? Well, we have to really think about what are the mechanisms for why people get reflux, right? I mean, you have your, it's all about anatomy, frankly. You have your LES, which is one of the main components of it, and by definition, as we're doing myotomies, whether it's endoscopic or laparoscopic, it's about dividing the circular fibers and really disrupting your LES. So then we have to look at it from a different standpoint. What about the angle of His? Because as we know, it's not just about the lower esophageal sphincter itself, but it's also the angle of His that contributes to the anti-reflux properties of the gastroesophageal junction. So the argument with POEM is that, you know, you preserve the angle of His. You don't have to do your circumferential dissection when you do a Heller, especially if you're doing a posterior fundo with it. But really, when you do a Heller and you do your partial fundoplication, especially a toupee, you are increasing, or I guess I should say, making a more acute angle of His. And by doing so, you're bolstering that angle, which is actually an anti-reflux mechanism. So to that end, you may not be disrupting the angle of His with a POEM, but you're actually enhancing it with your Heller and toupee. So again, POEM, yes, you disrupt the LES, but your angle of His is unchanged. With a Heller and toupee, you disrupt your LES, but you're enhancing the angle of His. If you don't believe me, go look at all the papers that are out there, and that's actually probably more than the actual number of papers that are out there comparing the two so far. But nevertheless, let's pull in a little bit of literature. And you know, one of the best places to go, actually, and this is a little plug for the SAGES and its guidelines, I served on the committee for a while, is to look at the guidelines about various procedures and management of disease processes. So if you look at the guidelines for the use of POEM for treatments of achalasia, this just came out last year, okay? So this is not from 5 years ago or 10 years ago when POEM came out. This is from last year. This is a direct quote from those guidelines. In terms of the harms and burden, the undesirable effect of reflux esophagitis, LA's grade B, C, or D, was seen more frequently at 2 years in POEM group as compared to the Heller myotomy with fundoplication group. And this is from that Werner study that was already mentioned earlier from the New England Journal of Medicine. So according to their guidelines, it says that the current evidence suggests that POEM leads to greater post-operative reflux, at least in the first 2 years post-procedure. Sounds pretty definitive from a guideline from a major society. And if you look at actually who the members of the society are that approve this. This is from the SAGE's Board of Governors, okay? So this is not just, you know, somebody like myself who's just, you know, some little yahoo talking about poem. I mean, I extracted the SAGE's Board of Governors for you to actually see. And I mean, you recognize a lot of these names on here. In fact, if I highlight a couple of them, Drs. Al-Saidi and Dr. Tellem are your program chairs for SAGES 2021, okay? So if this Board of Governors, including your program chairs, approved it, I think you should carry a good amount of weight. Again, you don't have to listen to me. I'm not on the Board of Governors. SAGES leadership, is anybody in here? Plug? Okay, never mind. But you can look at actually other members of the SAGES Board of Governors. So let's see here. Let's pick out a couple names. Drs. Horacio Osborne and Roy Pryor. Drs. Leanne Feldman and John Mellinger. If I'm not mistaken, Drs. Pryor was the past president of SAGES 2 years ago. Dr. Osborne was last year's SAGES president. Dr. Feldman is the current president, and Dr. Mellinger is the president-elect. So you have 4 of the most recent presidents of SAGES, who are members of the Board of Governors, who approved the document that said in the guidelines that poem is inferior to Heller myotomy and tupé fundoplication for reflux. I don't know that I have to say a whole lot else. I mean, yes, I can quote papers about Barrett's esophagus after poem. I could talk about esophageal adenocarcinoma after poem, but you know what? It's getting kind of late. The answer is yes, the Heller's better. Go enjoy the SAGES Gala. Thanks, everybody.